All right, so looking at the next set of drugs, all right, in obstetrics, we'll be looking at what is what? Uterotonics. Uterotonics. So if we say a set of drugs is a uterotonic, what do we mean by this sentence? So just so you know, they are actually agents, okay, so that they are drugs that stimulate contraction, or they increase the tone of the uterus, let the uterus contract faster. So they are essentially in obstetrics for managing labor, preventing or treating postpartum hemorrhage. So sometimes after a woman gives birth, she's bleeding so much, so you want to actually control that. So it's one of the a woman bleeding so much after she gives birth is one of the cause of what? Mother death worldwide. Okay, so primary use of these uterotonics is what? Induction or augmentation of labor, active management of third stage of labor, okay, prevention and treatment of postpartum hemorrhage, medical abortion or miscarriage management. Okay, so examples of these drugs that are uterotonics, we have drugs like what? Oxytocin, oxytocin. All right, we have drugs like what? Misoprostol. We have Carboprost. We have drugs like what? Ergometrine. We have drugs like what? Methylergometrine. Okay. Then we have drugs like what? Carbetocin. Okay, so this one is like class route of administration. That's like through which routes will they actually get it to your body. Anything IV is intravenous. All right. Intravenous, that means they will give it through the veins. Anything IM is intramuscular. They give it through the what? Muscles, The sublingual, that's under the tongue. Vaginal, they put it inside your vagina. Rectal, they put it into your anus. So that's just it. This one is kind of like their side effects, talking about their side effects. Can also pause to look at it. Alright. So World Health Organization recommends that oxytocin should usually be the first line of what? Uterotonics for what? Postpartum hemorrhage. Misoprostol is usually an alternative if oxytocin is not available. Carbetocin is as a heat stable option in low resource settings.